as you are aware that we have integrated the practicals which were not previously there in the post-basic BSc nursing program. So 20 units which were adopted from certificate in community health program are being prepared as practical manual 2, and these are specifically dealing with the certificate in community health program. So those students who are interested to go for the community health services in future, it will be beneficial to them to know about these practicals of public health importance. So as you know, in the community there are various activities which are carried out by community health nurses, mid-level healthcare providers, and the various health professional in a team. So you have to do a lot of assessments in the community, because unless you know the community, their strength, their weaknesses, and the needs of the community, then only you are able to identify their problems. And once you identify the problems, it helps you in planning the programs as well as planning the health services as per the need of the community. Keeping all these things in mind, as you know, you have to do the assessment. So assessment you do with the help of clinical examination. You do some measurements in the form of anthropometric measurements, and when we know that the health status of the community is important, then you must know about the morbidity pattern of the community, mortality, as well as the various fertility or the nutritional assessment, as well as what all nutritional deficiency disorders are prevalent in that particular community. Apart from that, one of the important activity which you also need to strengthen your knowledge so that you can carry it out as and when required. So that is the investigation of an epidemic. So we will discuss in this unit today in detail what all steps you need to follow to investigate the occurrence of an epidemic. As the disease outbreak, if you know, the disease outbreak often poses a major public health problem in the community. So it necessitates a prompt action by the health department. There you cannot wait, because it is an epidemic, it is contagious, it can spread rapidly from one person to another. So it necessitates your active participation as well as prompt action. So there are various epidemics which had occurred in the past, like cholera, dengue, chikungunya, Zika virus, as well as COVID-19. It was in the form of pandemic. So it is important to identify the source of outbreak, and if you know the source of outbreak, then only you can take corrective measures and providing health care to the affected individuals. Also, when you have identified it, then only you are able to institute preventive and control measures. So keeping all these things in mind, let us now come to know about the various steps which can be taken, or you are aware in advance that I have to do step by step how I can identify or investigate an epidemic in the community. So before knowing the steps, we should also know what is an epidemic and what are the sources of epidemic and what are the steps to investigate the outbreak, and then only we can take corrective measures in the prevention of further occurrence of the infection, and prepare and submit the report of the outbreak and carry out investigation of an epidemic. So with these objectives in mind, let us see what is an epidemic. Epidemic is the occurrence of the disease or occurrence in a community or region of a group of illnesses of similar nature clearly in excess of normal expectancy. This means that in the community, the region or the group which is affected having similar nature. Similar nature means that every person is coming with the same kind of sign and symptoms, and they have same kind of history or the history, like they have consumed something from the same place. So it is coming in such a way that they are in the excess of normal expectancy. They are not in the form of normal expectancy, but they are in excess or more than the normal expectancy. Then only we can say it is an epidemic. Then it is also, epidemic is commonly known as outbreak. So you should be clear about what is outbreak. It is a epidemic, or epidemic can be told as outbreak. So disease occurrence is in excess of the expectations. So this can be inferred by the assessment of records of the previous years. Like how you will come to know that in the if you are working in a particular health facility now, and you find that in the total month how many cases are there of particular disease, suppose diarrheal diseases. So you can go through the previous records in the same month of previous 3 years and find out that what was the situation in last 3 years of this particular symptom during this month. So you can find out the trend of the disease, like and clearly it can depict that whether in this month, in the current year, whether these are more in frequency or they are in the normal range or not. So that will help you in assessment of the epidemic. So whenever an epidemic happens, it's need to be investigated. Here I mean to say that when a patient comes to the hospital and you take history of his illness, as well as there are certain lab investigations also done. So why we are doing all these things? So that you can come to a diagnosis that what has happened to the patient and what treatment can be given now. So that investigation takes place in the hospital. Same way in the community. There you need to investigate that also, because in the community you don't have one patient, you are looking after the whole community. So in the community it is very important to know the underlying cause of the epidemic, because this epidemic has occurred more than the expected cases. So that if you have done the investigation in a systematic manner, then only you will be able to take the preventive measures and the line of the knowing what all factors has led to the occurrence of this epidemic, and you can prevent the spread of infection on urgent basis. So here it is also important to know what causes an epidemic. It can be, the agent can be a virus, or it can be a bacteria, or other causes of the disease has recently grown stronger, is introduced somewhere it has never been before, as you have seen the case of COVID-19 also, or the bacterial or the viral, or find new ways, agent can find new ways to enter the bodies of those it is affecting. And it also can happen if the people somehow grow more susceptible to the cause of the disease or have greater exposure to it. When we say exposure to it, there are cases which are showing sign and symptom of that particular disease, and those who are near and dear staying with the patient or that case, they become the exposer of that particular disease. So it has to be kept in mind whether it is a viral, bacterial, or any other cause, or there are many other factors which can be associated. So sources of epidemic, if we say, it can be a common source or propagated. So in case of propagated outbreak happens when the disease is passed from person to person. It can be through direct contact like sexually transmitted diseases, sharing an item or vehicle that passes the disease like needles. Needle become a vehicle. A person who are drug addicts, they share common needles, and also the vehicle borne transmission. So there are many sources of occurrence of the epidemic. Epidemic is also can be held to, with the vector like mosquitoes, also called as vector-borne transmission. As you know, I have mentioned in the beginning that dengue, chikungunya, they are as well as one example over here is about in 2014, the Ebola virus caused an epidemic that killed thousands of people in Western Africa, and it was a propagated epidemic as the virus spread through human contact with contaminated body fluids. So these are the you have to keep in mind that what can cause an epidemic. It can be a virus or bacteria, vehicle, or some vector like that. Then epidemic also, as a families attended to sick relatives and other caregivers helped the ill patient, so many were exposed to the virus and became sick themselves. When you are taking care of that contagious disease occurring in a case, so you get exposure to it, and those who have lesser immunity get again the disease, so they can also get this illness or epidemic. There are many other examples of epidemic like a common source epidemic or a point source outbreak occurs when a group of people get sick after being exposed to a virus, bacteria, toxins or other infectious agent from the same source, common source. Like for example, when a group of people get sick after eating the same contaminated food at the same restaurant on the same day. So these things are important when you are asking the history from the patient, whether they were in a group, they ate the food at the same place. It can be a party or some event where everybody was together and they had at the same time they have taken the food, and after certain duration they started having the symptom. So there is similarity of nature of the epidemic among a group of the persons who have taken the contaminated, it can be contaminated food or contaminated water also. So that can lead to the occurrence of the disease in more than the normal expectancy, and history shows that they have used the common platform of agent, they got exposed and got the symptom in the similar nature. And it is also important that infected within a short period of time, because they have consumed at the same time. So within the shorter duration they had been infected in a shorter period. Like Delhi experienced an outbreak of cholera during July to August in 1988, which affected residents from all walks of life. Means it did not see any age, even a small child till elderly, all were affected, and a total of 1824 laboratory confirmed the cholera cases were detected in 2 months period in the Delhi hospital. So this is one of the example that how in a shorter duration a large number of people were affected with the similar nature of the illness, and every laboratory confirmed that these are the cases of cholera. Now we come to the before we go to the steps of investigation of an outbreak, I would like to mention here the public health, one of the public health scientists who which has been given in the book also, Rudyard Kipling, who had written that I keep six honest serving men. They taught me all I knew. How do you investigate an epidemic? Their names are these six honest serving men are what and where and when and how and why and who. These are the six questions which need to be answered, which need your queries, and which needs becomes the step to investigate the epidemic. Like what has happened, where it has happened, when did it happen, and how it occurred, why it occurred, who is culprit, what has happened, and who all are affected. So these are the questions which needs to be investigated to identify the factors who are responsible for the disease occurrence as well as the distribution of the disease. So you might have heard about the disease outbreaks off and on from several parts of the world. Like I have mentioned the cholera, dengue, chikungunya, even the Zika virus, etc. Such outbreaks of the disease often pose a major public health problem in the affected area, and you have to take prompt action to investigate these activities because they are highly contagious. If you don't take prompt actions, it can spread so rapidly that all come into the trap of this, and there can be a very, very large amount of case fatality. That means death rate will become very high if the corrective measures are not taken promptly. So that is the reason we need to strengthen our knowledge about the epidemics as well as how to investigate these epidemics. So the steps of investigation of epidemic include: first step is ensure that existence of the outbreak. You have to ensure that is it really an outbreak or not, or it is just like that. So you have to ensure yes, it is an outbreak. Then second step is the confirmed diagnosis. I will be discussing all these steps one by one, but first you should be able to answer. If you get this question in Viva also, you can get that tell the steps of investigation of an epidemic. So you should be able to tell all the 6 steps. So first is ensure existence of an outbreak. Second is confirm diagnosis. Third is the estimation of number of cases. Then analyze the data in the form of time, place and person. Then determine who is at risk of contracting the disease and prepare the written reports. So these are 6 steps. Every step is important at its own end, and if you miss even the last step, preparation of written report, then all 5 are a waste until unless you write the report of the epidemic which has happened. So let us see one by one. Before we go to these steps, I would like to tell you one more thing, because you are going to investigate an epidemic. So what kind of epidemic? I have explained you what is an epidemic, what are the classification, how an epidemic can take place through common source or through bacteria and viruses. Like you also need to, when you are investigating it, you need to have case definitions. So what is case definition? Standard case definition for the suspected cases of acute diarrheal diseases. So you have to first of all standardize cases and by giving the definition. So in an area where the disease is not frequent, some of the diseases which remain throughout the year, but in some area it depends from various geographical areas. In one particular geographical area, maybe one kind of disease is more prevalent, in some other area maybe some other kind of disease is prevalent. So in an area where the disease is not frequent and a patient is of 5 years of age or more, develop loose motion. Suppose a child develop loose motion with dehydration or dies from acute watery diarrhea. So even that death is very, very important to understand, that if a death occurred due to diarrheal disease and dehydration, then in that area, because the disease was not frequent, and so that death become important. You have to certain things you have to be very careful. So in case of cholera endemic, so throughout the year cholera cases keep coming, but in an area where cholera is an endemic and patient age 5 years or more develop acute watery loose motion with or without vomiting, so that you have to find out. And a confirmed case of Vibrio cholera, that is in a patient suffering from loose motion, diarrhea, then bacillary dysentery can be suspected if there is acute onset of diarrhea with visible blood in the stool. So that is a bacillary dysentery case. So that you have to identify. Then in these cases, if it is the cause of the loose motion is due to bacteria, then it can be Shigella dysentery type 1, and that you can say that the symptoms include loose motion, abdominal cramp, fever and rectal pain. So from where the Shigella has come, it is through the laboratory diagnosis. Then dysentery type 1 usually progresses to the most severe form of dysentery with life-threatening complications. So there can be death. The most common underlying cause of death in fetal shigellosis is severe colitis. So cause of death will be severe colitis, and the immediate associated causes are septicemia as well as pneumonia. So in Shigella dysentery type 1, these are the references from where I took this definition. So now confirm the outbreak. Confirming outbreak is the first step of the investigation of the epidemic. What will you do? You identify the cases using the standard case definition. So when you have developed the standard case definition, based on that standard case definition, you start identifying the cases, and then only you confirm by clinical history, by clinical examination. You can do examination of the patient. Suppose in case of dehydration, patient is having dry mouth, dry lips, lips are dry, as well as when you do skin integrity, it is not, you hold it and it is not going back easily. So this is the cases of dryness. You can examine and do the laboratory testing of the stool sample to determine whether it is to determine the agent present in that, as well as you can also do the antimicrobial sensitivity. So how it is not just by seeing one or two cases you start saying that yes, outbreak has happened. That can cause even a rumor, and there will be more anxiety in the community that something has spread. So it is not like that. Once you have to establish with the help of you have to ensure that yes, it is a case of epidemic, because many patients are coming with a similar kind of history. They have similar kind of consumption of contaminated water or food, as well as the laboratory testing is also diagnosing that it is a case of all are having similar kind of causative organism. So you need to identify the cases and need to prepare an epidemiological case sheet, inform information for the case detection has to be taken from the patients in the, through it can be data can be collected through house to house survey also. Identify the characteristics of the patient as well as the probable source of infection, from where the infection might have happened. So that way you identify, you give the case definition, you try to examine the patient, ensure laboratory investigation, and then come to some confirmed diagnosis that yes, an outbreak has happened. So I will be till now I have discussed about the what is an epidemic, what are the various strengths and the health determinants which you have to keep in mind to know the health status of the community. Assessment is very, very important, and this assessment, until unless you do it in a systematic way, it will be difficult for you to diagnose in the community that something has happened. So it is easy in the hospital setup because you are dealing their patients in at 1:1 ratio. Every patient is having with the different kind of problems, and you give different kind of investigations to carry out. But in the community, when you are focusing on investigation of the outbreak which has happened to the large number of people at the same time or in a shorter duration of period, they have all consumed contaminated food or water at common source and at the similar time, and they are coming within a short period of time, large number of cases coming in the health department, where you get suspicious or you get alert that is it an epidemic occurring or an outbreak occurring. So you have to take certain measure, and sometimes you are not just taking at that time when number of cases are more, so you there does not depend on detailed history of each patient. Here you are taking few samples and every sample is showing the similar suppose it is a virus or Vibrio cholera causing cholera epidemic, so every sample will be having cholera detected in their sample, stool sample, and similar characteristic will be there like rice water stool. Everybody will complain of the rice water stool or the vomiting or the fever. So that help in estimating that yes, an epidemic, it might be an epidemic and it has to be investigated. So the first step we have discussed is you have to ensure the existence of an epidemic, and second step is community diagnosis. Then you confirm with the clinical history, with the laboratory investigations, and you come to the community diagnosis that yes, an outbreak has happened. So we will be continuing after a short break in the same topic. Be with us. Thank you very much.
Do you know that the world's population has reached 8 billion on 15th November 2022? And we are still counting. I don't know where do we go from here. The predictions are scary. Any idea how many people can Mother Earth sustain? India's growing population is a serious concern, and we are soon going to become the world's most populous country. Wow, number one. Population is, after all, a human issue. the UN proposed Sustainable Development Goals cannot be achieved unless and until we consider the population dynamics. So, here we are. Indira Gandhi National Open University offers appreciation course on population and sustainable development. The course explores the linkages between population and sustainable development. In this course, there are diverse issues related to population, environmental safety, livelihoods, human health, migration, urbanization, and much more. The course duration is 3 months, but of course, you can complete it within a year. The eligibility of the course is graduation from a recognized university. So, if you are a development professional, working in a government sector, researcher, or keen to know more about the population and sustainable development, the course is must for you. Hurry up and join this course so that we are able to convert population into demographic dividend and not convert it into demographic disaster. For more information, visit www.ignou.ac.in. Thank you.
Welcome to all the students who are attending this teleconferencing session. So, after the break, we are continuing on the same topic, investigation of an outbreak. So, I have discussed in the previous session about what is an epidemic, what are the sources of epidemics, and how an epidemic occurs, and what is the importance of these 6 human questions which has to be answered: who all are affected, how it has happened, what has happened, and what all measures to be taken to control the epidemic, and where it has happened. So time, place, and person, very important to know about all these things before the occurrence of the epidemic. You have to keep all these questions in your mind, that and you when you are in the community, everyday patients are coming to you, and this occurrence of unusually a large number of cases in the community should lead you to suspect that it must be an outbreak or the epidemic. So we must bring it to the notice of the health authorities. If you suspect that number of cases are increasing over a short duration of time, so you have to alert the health authorities also. So if you remain alert, you are prompt in taking these actions, then you can contain the future spread of that infection in the entire community. So then only you can say that you are alert and you are doing your best in the community and preventing spread of infection or controlling also. Then sometimes people are not aware of any such phenomenon, that but the routine records and the show that a sudden rise in the number of cases are due to particular disease. So you have to take certain measures. You have to ensure that is it really an epidemic which is occurring. So you can ensure with the help of the clinical history. And here, as I told you, that you are not going to go in detail of the history of each and every patient, because all number of large cases which are coming to you are having similar nature. They have consumed from the common source somewhere. Maybe the water was contaminated in that area, or the even in that geographical area, maybe all the cases are coming from a area where the sewage treatment plant, they are living nearby sewage treatment plant, so they all are giving history that we are staying in that particular corner of the area, and from there only every case is coming. And if some other case is there, he or she might be having some other illness, but those who are around that sewage treatment plant are giving similar kind of history, so you become suspicious that might be they have undergone exposure to the contaminated water, etc. So these things you have to remain alert in the community, and try to remain suspect or alert, so that you can take prompt action in the community, and you ensure that yes, it is the outbreak which has happened. And also need to keep in mind that you avoid rumors. If it is not the case of epidemic, so it should not be spread. False information should not be spread, so because it can lead to some other anxiety and distress among the community. So we can say that increase in the number of cases beyond expected number in case of those disease which are endemic can be considered as an outbreak. If the number is exceeding than the normal limits, then only you will say it as an epidemic. Thus, we can say that in case of an endemic disease like diarrhea or acute respiratory infections, it is expected that there will be some cases throughout the year. Some or the other case will, because it is endemic in that particular area. Endemic means throughout the year cases will keep occurring, 1, 2, 3 or like that, but it keep coming throughout the year but does not exceed the normal limit. So keep a watch for sudden increase. That is why you have to keep a watch on sudden increase in the number of cases due to these diseases in your region where you are working. So also you have to keep one more important thing in mind is the season specific watch should also be kept. Like in the rainy season, more of cases are of the diarrheal diseases occur. So also you have to prepare yourself that as per this season, which disease is more prevalent, and you have to keep certain measures immediately to impart to the patients. Like in case of diarrheal diseases, ORS packet should be there with you. If you have no ORS packet available, then what preparation you have done for to remain alert for that particular season? So you have to be very careful, and also you can even plan the health education program in that area, that in this month, like in rainy season also, vector-borne diseases, mosquitoes are more prevalent, so it can lead to malaria, dengue and chikungunya. So you can even prepare in beforehand your health education material using posters, charts, or how you will make them aware, so that before the occurrence of any such disease, you take measures and alert the community or make them aware, because you alone cannot help in everything. If you are interacting with the community, making them aware about the seasonal variations and what precautions they need to keep in mind, so that they avoid at per maximum limits, so then you can, it is easy to control that particular disease in case more cases also occur. So you need to prepare yourself. So first step in the investigation of an outbreak is the ensure existence of the outbreak, for which we have mentioned that you have to take little clinical history, you have to do examination as well as laboratory testing which confirm the diagnosis. Then second step in the investigation of investigation of an epidemic is the confirming the diagnosis. Need to confirm, as it is vital, since once the diagnosis is clear, our response will be more systematic and effective. If diagnosis is wrong, then the medicine will go wrong and there won't be any improvement. So it is very important to confirm the diagnosis so that right type diagnosis will help the patient in getting right treatment also. So when there is large number of cases occurring simultaneously in the community, it may not be possible to take the detailed history. Then if number of patients are more, does not require much of detailed history as well as clinical examination for each and every case, because the signs and symptoms of all the disease are similar. Every patient who is coming to you with the similar kind of history, diarrhea, vomiting, fever, so everybody is complaining the same thing. So that help in making the diagnosis, and you can make a working case definition. You can make that as per based on the symptomatology as well as the clinical signs of the disease. Here you can see one more thing in when we are confirming the diagnosis, that there are some subjective symptoms and some of the objective measurements. So subjective symptoms or subjective criteria of the symptoms are based on what the patient feels. What the patient is feeling or he is experiencing, he tells you. For example, loose motion, pain in the abdomen. Patient immediately say, I am having pain in abdomen, vomiting, you can see it. So for in case of the diarrheal disease, so these become the subjective data. And on the other hand, if you are taking the sample as well as giving it to in the laboratory for the diagnosis, and you can even observe, assess the symptoms of dehydration based on the examination, like patient is having dry tongue, less urine output as well as slow skin pinch. So this becomes the objective data. So based on two findings you can confirm the diagnosis. And during the epidemic there could be many individuals affected and only a few individuals affected, or all got exposed but some have got infection. So if number of cases is small, each and every case can be examined thoroughly. It depends from situation to situation as well as the number of patients. If the small patients are small in number, then you can take the detailed history also. But if the number of cases are in the large amount, many patients are coming, it is not possible for all of them to have a detailed history, because lab investigations are confirming similar organism present with the similar kind of history. So in such situations, investigation may be carried out on the representative samples. You must have heard that there is a large population, but it is not possible or feasible to conduct test in each and every. So you can take a sample from that large population and who are affected cases to confirm the diagnosis and find out the important information related to the agent, host as well as the environment. And also you are asking every patient their mode of transmission, how they have consumed contaminated water. So you can say the contaminated water, or they have fecal-oral route is also very common. So that help in the confirming the diagnosis. and in few cases, if required, you can take the blood sample or the other specimens for the confirmation of diagnosis. So after the second step, confirmation of diagnosis, then comes the third step of investigation of epidemic, that is estimate the number of cases. It is also very important, as I have in the previous session explained about the case definition also. So using the working case definition, you need to estimate the number of persons affected. So how you will do that? You will collect the relevant data such as the age of the patient's age, sex, place of their residence, as well as the history of, if there is any history of travel and exposure to a suspected case. Suppose they have gone to meet that case and now came back, so they become the exposure to that case. So that also you need to ask, and a detailed history about the symptoms present. So for that there is an epidemiological case sheet is also given in the practical manual, in which you can take this data, like you take the date and time when you have visited the patient, name of the patient, age, sex, his address, residence or workplace. Also you can ask where he is working. Maybe he caught the infection from the workplace or the residence, we don't know. So if you know the both of the things, then because then the contact number is also very important. Sometimes some information is left which you find in some other patients, and you need to clarify from this patient also, so you can ask on phone. Then date and time of the onset of symptoms, when they consumed that in the party, and after consuming that contaminated food, after how many, maybe within half an hour they started having symptom, or within 1 hour they started having symptom. So onset of symptom, when the symptoms actually started after consuming the contaminated thing. So symptom also you can ask whether, because you have to take rapid history, so you ask loose motion, yes or no, tick, you can just tick mark. Pain abdomen, hai nahi hai. Vomiting, yes or no. Dehydration hai ya nahi hai, that you can even assess. Then you also ask the source of water supply, like are they consuming tap water, hand pump, supply is from the well or river, or they are using pond water. So it depends from the geographical area where you are collecting the history, and some time they are using natural water body also. And history of travel outside, is have they traveled outside during that period. So history of intake of food items is very important, whether they have consumed food prepared at home or they have consumed food outside the home, from where they have taken this item, that you can ask and write here. Any medication taken, and the name if record available, if they know, did they, because nowadays many people are aware about even medications, so they start taking at their own. So if it is so, then you need to ask about that. And before coming to you in your health facility, or you have gone to take the history from them or do the survey in their houses, you can ask any laboratory investigation whether they have undergone or check and note based on the available record. If they have undergone some laboratory investigation from outside agency or in some private clinic, so you take the record, you can ask them to show the record, so that you can note down that this patient has undergone this lab investigation, and that history is with you. Then family members, how many family members are there of that patient, list with the age, of those family members suffering from any infection of the similar nature, their onset, day and time. So you will collect this information using the epidemiological case sheet, and so that it is easy for you to take a large number of information in a short period of time. And using this, you have to use this because this will help you in estimating the number of cases, because this is the third step of investigation of an outbreak. So suppose this is for one patient and you have collected the information similar of nature in 50 houses. So you have data of 50 patients. Out of 50 patients, you can analyze that according to age wise, according to the how many female or male have suffered, and in the short number of cases in the duration, maybe within half an hour duration. So you can write as per the history given by 50 patients in the community. Out of 50, maybe 25 will tell you that they have suffered within half an hour of consuming that contaminated food or water. So that way you can find out the number of cases in the community. You estimate how many cases are there. Then based on that, you will analyze the data in terms of the time, place and person. That onset of the illness in number of cases was half an hour. The number of cases who prolonged in the symptoms were depending upon their history, maybe prolonged for weeks. How many prolonged for 1 week, how many prolonged for more, or whether number of cases increased in between or decreased during the when you are taking over a period of time the data from the patient. So you can draw the epidemic curve which has been mentioned in your practical manual. You can read it from here. So epidemic curve of the outbreak you can plot based on the analysis of that data, or then you this is the fourth step of investigation of epidemic. And the once you have analyzed this, you can determine who is at risk of contracting the disease. So this will be the fifth step. You, based on that analysis, you interpret that data. You have calculated certain incidence rate or prevalence rate, or you can also calculate the attack rate as well as the case fatality rate. So these will help in determining whether the incidence of the new cases is increasing, or you have put the measures in such a way that disease is under control. So that will depend upon the incidence rates. So what is an incidence rate? It is the new persons with the disease. How many new persons you got from the total population at risk, and you multiply it by 1,000 and it will give you the incidence rate of the disease. So it is very important, if the population is at risk, how many of them are at risk, because they can also catch the infection. So that is why we are telling this population at risk. And then prevalence rate also you can calculate. And what is a prevalence? That persons with the disease. Here the disease means number of new cases as well as old cases together are in the prevalence out of the total population at risk. Multiply by 1,000, it will give the prevalence rate. Whether the prevalence is on the rise or prevalence is on the lower side, which will help in depicting the health status. Then case fatality rate is also, you can calculate. Case fatality means persons dying from the disease. whether any death has taken place or persons how many have died during this epidemic period of the similar nature, and from the number of persons with the disease during this specified period. Out of those deceased, how many have died? So that will help in finding out the case fatality rate. So that way you determine who is at risk of contracting the disease. So you see, when the outbreak is limited, as you know that to certain population, suppose like the cases of food poisoning among those who have attended a party or a feast at certain area, local area, and suffer with the infection in a particular residential area, the investigation can be focused on this restricted population. Here, only because they were exposed, they have attended a common place or party, so their number of cases are of course high, but it is in the restricted area only. So population at risk will be that population only who have consumed in that particular party. So there are many things you have to keep in mind while working in the community, and keep a watch on each and every aspect, geographical area, time, and who all are affected, as well as the place where the disease is more prevalent. Then sixth step or the last step of this investigation is the preparation of written report. As I have mentioned in the early slide also, that unless you write a detailed report of this incidents which has happened, outbreak which has happened, and it is the most important step to prepare the written report. It forms the basis for the action by the health official, because if the detailed report is there, that number of cases you will mention every detail, that this was the locality, in this locality how many persons were affected and which age group was more affected than the other. So yes, so these all things will help in further planning and giving the health benefit to the community as such. And you have to mention the complete report comprising the background information, the methodology, which method you have adopted to calculate the information or collect the information, investigations you have carried out, and analysis and interpretation of data of the agent, host and environment, as well as the mode of spread of the disease. So this report will help in preparation and implementation of the further planning. So with this, we have covered today how to investigate the occurrence of an epidemic or outbreak in the community. Hope it is clear to you. Thank you very much.
Positioning. Now we will discuss about the position. Positioning is placing the patient in a good body alignment for comfort or therapeutic need. Why we are keeping the patient in a various kind of positioning means the purposes of positioning. First purpose is to provide the comfort, to promote the therapeutic function. Third is to prevent the complication related to immobility. Fourth is to stimulate the circulation.
Students, in today's class we will be carrying out the testing of various adulterants and preservatives in the milk. तो आज हम सबसे पहले जो है करेंगे दूध में सोडे का टेस्ट. दूध की डेवलप्ड एसिडिटी को घटाने के लिए जो अनस्क्रूपलस पीपल हैं वो दूध के अंदर जो है सोडा डालते हैं, सोडियम कार्बोनेट या सोडियम बाइकार्बोनेट. उसको डिटेक्ट करने के लिए हम जो है एल्कोहलिक सोल्यूशन ऑफ रोजैलिक एसिड लेते हैं। तो ये एल्कोहलिक सोल्यूशन ऑफ रोजैलिक एसिड है और ये जो है ये सोडा है जिससे हम सैंपल को एडल्ट्रेट करेंगे। और जिस सैंपल में सोडा डाला जाएगा उससे रोजैलिक एसिड के साथ जो है